Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. Hey everybody, welcome back to Between the Sheets. I'm excited to have a guest with you today, and she has some of her toys with her today, so if you pop over to our YouTube channel, you can see some things as well as hear and learn. Have you ever wondered who to turn to when you're having problems between the sheets with pain and fear? Dr. Sara Panek with Prosper Physical Therapy and Pelvic Rehab is a great source for you when it comes to pain with sex. She is a pelvic floor physical therapist who has helped hundreds of women just like you overcome this. So we're very excited to chat today and learn more about this topic. Hello.
Hello. Thank you so much for having me on today.
Yeah, I'm excited.
Me too. So this is a really broad topic and it is so much fun to talk about because it doesn't like to be talked about a lot, right? So the idea of pain with intercourse, it's like this big blanketed term that is talked about a lot where what does that truly mean? Like we could talk for hours on this subject and really break it down to specific situations, specific things. But I think for the purposes of this podcast and recording, that it'll be best to just kind of break it down into three subconscious or subparts to really kind of hone into a majority of what people experience. Now, I'll caveat with this saying that what you have experienced in your own time, in your own world, may be completely different than the next lady listening to this podcast. So I hear you and I understand that this may not be a fun subject to talk about either. So if this brings back some memories or some thoughts, it is totally normal to have that come on with this conversation. So if you have some tears that come out, it is totally fine. We are here for you.
Yes.
Steph and I are super excited to be able to talk about this with you guys. And so I just want to make sure that you understand that before we get into the deep dive of this. So let's talk about like the very first time, right? Or the idea of aging. So with the very first time, it's kind of like a full circle event because you've got a lot of different things happening down south, i.e. within the pelvic floor. So when I say the word pelvic floor, I sometimes get the deer in the headlights look like, what are you talking about? And what I tell people is like, I talk about the space between your legs, girls. That's what we're talking. We're talking about the vajayjay, girls. Let's talk about the coochie a little bit, okay?
Absolutely.
So with the coochie, she has to go through a lot. She's got to be able to stretch. She's got to be able to contract. She's got to be able to push babies out. She's got to accept various different devices and sizes of erections, all the things. So it's important to understand that the very first time intercourse happens, that it may or may not be a really fun experience. So if you're listening to this and you haven't had intercourse yet, or you're saving yourself for marriage, or you're in your teens, or wherever you are in your life, it can kind of depend on what that looks like for you long term. So between the sheets, we've got the anatomy of the pelvic floor. So if you're watching this on YouTube, this is a really good anatomy lesson for you because I have to show you. It's just part of my world. So hello, welcome to your pelvic floor. Here she is. So this is your pelvic floor. And we've got 3 openings down here. So these guys are your sits bones. So if you're sitting on your couch or in your car listening to this podcast or watching the video of this, you got your sits bones. That's where you feel your butt. So if you kind of roll side to side, that's what you're going to feel, are those 2 butt bones. Now, between those 2 bones is your pelvic floor. You've got the clitoris, which she is your arousal girl. She is going to help you with lubrication. She's going to help you achieve the big O. She's going to be the tell-all be-all of all the things. Then just down from her, you've got the urethra, where you pee from. And beneath her is the vaginal opening, i.e. where things get inserted, where things come out, where babies come out, right there. Then further back from that is your butthole, where you poop from. Between all of this is called the perineum, and this baby gets stretched a lot, especially if you are pregnant or postpartum. She is one that is going to have to move out of the way. If you hear of tearing, that's where that can happen. So returning to sex after having babies, this is why it can be scary for people. So quick anatomy lesson on that. And then if you are a first time lady having intercourse, sometimes there's what's called a hymen. A hymen can go over the vaginal opening, basically creating like a string effect. So if you've got your vaginal opening, if you make an O with your hand and then you put a finger on the other side of it, that is a hymen. And the size of a hymen can vary and be kind of the issue. Or if you hear of people talking about their cherry popping, that's what's happening, is that hymen is breaking. It is tissue. I had a hymen. It was not comfortable. It was very, very painful my first time having intercourse because of that hymen being in the way. But after the fact, it was very good. So just so you're aware of those types of things that can go on. And then based on your vaginal shape too, some vaginal openings are tiny, some vaginal openings are big. Or I encourage every single woman even after this video to just go in your bathroom, lock yourself in there, take a mirror and just look, because people don't know what it looks like down there. You're afraid for whatever reason. Society makes us seem like it's not a good idea to go look at this stuff, when in fact it's totally fine to just explore and understand what our body's doing down there, because you understand what you got to do with your face when you put your makeup on in the morning, right? You got to understand what you're doing down south too. So
well,
it's
and
really
I've
important.
told them too that you really want to know what you look like. So if something does change or is wrong,
Right.
you know what you
Right.
normally look like and now what you look like when there's a problem. So it's easier to identify.
Right. Exactly. You need to understand what that looks like for you in your norm. And then if you're in your childbearing years and you wish to have babies, things are going to shift down there too and not look the same. You're going to have increased swelling. You're going to have all these different types of things. Kind of a quick story. My sister is a occupational therapist, and so when she's like, what do you do in your world? I'm like, I teach people about their pelvic floor and all that type of stuff. And she didn't realize that you have technically 4 lips, essentially 4 labias. You have your labia majora and labia minora. And she's like, oh, really? There's 4 of those suckers? I'm like, yeah, there is. Go take a look. And she's like, oh my goodness, yes, there was. So it's just important for you to understand. Yeah, grab the mirror. It's important for you to just understand that those are like your anatomy is so important to understand, so you know what is normal and not normal. And if you have heaviness or prolapse type symptoms, so prolapse is where something is starting to fall out, and that can be uncomfortable for you, can feel heavy. So if you were to take a mirror after looking when things were good, and then after having a baby, looking down there and like, oh, something's not right. So that's important to just understand.
Come
so
see
very,
us.
very good. Come see us. Yes, we can help with that type of thing. Not everyone needs a surgery. So that's a whole nother story too. But anyways, back to pain with intercourse. So in your younger ages, your hormone levels are going to be skyrocketed. You got great estrogen flow, all those types of things. But then full circle, come aging process, perimenopausal age, getting into menopause, estrogen levels start to drop. This is when estrogen is a helper for lubrication. If things are dry down south, that can make intercourse extra painful too. So being aware of that and knowing what kind of lubrication is important to use. And I always have to overcome the stigma of lubrication with patients because they're like, well, that's just because I got to go to a sex store to get that. And I'm a Christian and I can't do that. Right. There's a difference between it being a medical helper and a pleasurable, weird societal thing. So I say, if you change your mindset on that, where it's important for you to be comfortable with this, and
Mm-hmm.
make it enjoyable for you and your partner, then that's where the mindset shift needs to be. So, and
There's
they're like,
also
oh yeah,
this thought
that makes sense.
of, yeah, and there's also this thought out there, well, I should just get wet enough. I don't
Right.
need I shouldn't need it, right? Or that
Mm-hmm.
my partner might be offended because I'm using lubricant because they didn't get me wet enough. No, as you get older, you're not going to make as much lubricant. You do need
Right.
help with that to protect those
Right.
tissues so you're not tearing, so you're not increasing your risk of infection. So it really
Right.
is, like you said, helpful medically and
Right.
not just, a new sex toy, which
Right.
there's
Right.
nothing wrong with those either.
Absolutely. So I tell ladies to find one that is a water-based one or a
Yes.
silicone-based one. If you're using sex toys, be sure to have it be a water-based one, because a lot of sex toys are silicone themselves, and silicone doesn't like
Hmm.
to play with silicone. So I like, in clinic, I like to use slippery stuff. Good Clean Love is another fun brand. Yes. Uberlube, if you're just using it for intercourse and not using it with a sex toy, Uberlube is fantastic. It is a
Yep.
great one to use. It keeps lubricated the entire time. And as a woman, and just so you're aware, as a woman, it doesn't, the idea of being wet enough, it takes women, I can't remember the numbers, but it's like tenfold to what it takes for a man to
Hmm.
achieve an O. So
Yep.
making sure that you're aware that it's going to take a lot of foreplay for you to get aroused enough to increase the swelling within those labia to allow that arousal to happen successfully. So
Yep.
don't let your partner disturb you or deter you from that
Hmm.
when it comes to intercourse itself. Now, kind of continuing on into the next phase. So we kind of talked about that first time and aging, how it can be that full circle effect with how your hormone levels are. Now let's kind of talk about postpartum. So after having baby, and that's kind of where my bread and butter is in my world of pelvic health, is I see a lot of ladies postpartum. Now I tell them that postpartum can be day zero. It can be 30 years down the road. You are still considered postpartum no matter how far along in your postpartum journey you are, because so many ladies in their 40s and 50s didn't have the help that we have today back then
Yeah.
when they were having their babies. So I tell them, yes, you get the all clear at 6 weeks, but what does that truly mean? So in the
Hmm.
OB medical world, they are specifically looking at your tissues from a healing perspective. Is everything coming back together? Yes. Is the cervix where we want her to be? Sure. Okay, you're good to go. Go have fun. In the pelvic health world, we're looking, yes, the tissue's healing. It's healing as we want it to, but how is it doing in the next layer down? How is it doing from a muscle standpoint? How is it doing with that contract and relax process? Is it able to expand to accept a penis again or a sex toy again? What does that look like for you? And that's where our world comes in. And a lot of times it comes back to a fear mindset too, of the last time that something left my body or was in my body was the size of a watermelon. And now
Yep.
you're expecting me to do this again. And I
Yep.
always think of like the first time you have to have a bowel movement after having a baby. It's like the
Hmm.
last time something left my body, I don't want to push. I don't want to push this thing out again.
Right.
It's not fun. So it
Right.
can be that type of thing. And even if you didn't have a vaginal delivery and you had a C-section, the idea of
Hmm.
having to use your core to breathe
Hmm.
through intercourse, because what a C-section does is it goes through 7 layers of tissue, the most invasive surgery out there. But yet we're given the, okay, don't lift anything heavier than your baby. Have fun, make
Yep.
wise choices.
Yep.
But then with the fact that after you have a C-section, things are healing as they want it to. But I argue that C-section ladies need help more than those that have vaginal deliveries,
Hmm.
because of all the scarring that can occur internally that isn't
Sure.
addressed. And
Right.
that's where issues come with pain with intercourse, because obviously as you enter into that vaginal canal, you've got a lot of restrictions internally that can be on like the front portion of the the stomach area, uterus area
Mm-hmm.
versus the back area. And even depending
Sure.
on how baby was resting in the pelvis and how your pelvis adapted to baby being in there,
Mm-hmm.
there can be some scarring from that too, because if baby's head is
Sure.
just playing rockabye baby in there and
Right.
they're just settling in and getting nestled in, it's like laying
Sure.
on your shoulder all night and you don't move, right? So you
Right.
wake up and you got a sore shoulder, same type of concept, where
Right.
you've had this pressure on there forever and you can't do anything about it. So
Right.
there is
And some
definitely
women get
hope
a
for
lot
you.
of adhesions from the C-section scar as well, and
For
those can
sure.
be
For
painful.
sure.
Yeah.
100%.
Yeah.
100%. So the mom pooch, the numbing, all that type of stuff is common to
Mm-hmm.
happen, but is totally treatable for you to make it go away so that you can get your six-pack abs back, so you don't have this mom pooch, so you don't have the numbing. All those types of things are out there and available for you. So just so you're aware that when you return to intercourse after having a baby, be sure you're using some sort of lubrication. If you want to get in all clear, see a pelvic health therapist of some sort. Even if it's just for a couple of sessions, like, hey, I just want to make sure
Yeah.
things look okay. I want to make sure things are moving as we want it to. Most of us out there are totally open for that for you. And
Mm-hmm.
if you're looking for someone, I live in South Dakota. If you're looking for someone in the Midwest, I'm here for you. If you're even in the United States, anywhere, I can offer virtual assistance to you as well. So if that's something that you'd be interested in, I'm sure Steph will have my contact info and all of that as well for you
Absolutely.
guys too. So
Yeah.
the third one, kind of getting into a kind of a touchier subject. So fear and trauma. Sadly, this is the case
Mm-hmm.
for some of you. It is a thing. It is unfortunate that it has happened. Even in your younger child years, something could have happened and you didn't, and
Yeah.
you didn't know at the time that it was traumatic. But now, full circle later on, you have been through counseling for something, and it kind of brings
Mm-hmm.
it back up. I'm trying to think of what the terminology that counselors use for that specific, like, recall of things over the years, and you're stuck at
Yeah, I mean,
age
some people don't even
14.
remember it. Yeah,
Right,
and
right, right.
especially when it's even younger and they don't remember and they've completely repressed this, and all of a
Yep.
sudden it's like, "Oh, that's why I have all these issues." And then now they got to deal
Hmm.
with that and
Right,
it's brand new.
right. It's brand new for them because their brain basically shut it out, and now we're
Mhm.
trying to recall or get through that phase and heal
Yeah.
it there. So it's a natural fight or flight response. What's happening there isn't uncommon. So if you have experienced that and you are talking to someone, props to you. We are so excited for you, and there is
Yeah.
hope out there for you for that. Um, Social media and movies are also not a good thing for us in today's world as far as all
Yeah.
of that type of stuff coming up, because I'm in a whole bunch of different mom groups, and the first thing you see is trigger warning, and what does that do to your brain? You want to read
Mhm.
it because you're like, oh, what are they
Yep.
triggered by? So you continue to read it versus and then it can trigger something for you because it's just like this
Yeah.
constant effect that can happen. So understanding that there's help out there for you from a physical standpoint too, beyond the mental.
Mhm.
So you're seeing your counselor, and whenever that time comes where you feel safe and ready, there's people out there like myself that can help you through these issues. So what
Yeah.
can be done? Consulting with a pelvic health therapist is probably the number one thing that we can do. We can give you exercises, we can give you dilators. So, what is a dilator? A dilator, if you're watching the YouTube video, you get to see all these fun things. A dilator is basically like a mini penis, per se, if you're watching
Yeah.
or listening to this, where they have different sizes. I just grabbed 3 of them, and they can be smaller than this or larger than this. So, my pinky is
Mhm.
pretty small. That's probably the smallest that they go. So it's very, very little. So it allows you to practice inserting something by yourself before you
Mhm.
return to inserting a penis or a sex toy or something a little bit
Mhm.
more arousing than a dilator. But with them, They help stretch the tissue. You learn to breathe with them, how to move your body with something like that in there. Even ladies will have issues with tampon insertion because of past traumas or pain that way,
Sure.
where using a dilator can help stretch the tissue, teach the tissue how to move again. Similar to, I tell people that the pelvic floor is no different than any other muscle. So you get trigger points in it, like you get knots in your back. You have to exercise that muscle just like you have to exercise your biceps. Same type of concept within the pelvic floor, where we have to exercise it, teach it how to live again after traumas, after birth, as we age, all those types of things. So use of proper lube, as we've talked about, is another thing that can be helpful for you. And then just using self-exploration. Again, taking the mirror down there, laying in bed, let your legs be in a butterfly position, prop that mirror up with a pillow. If you don't have a mirror, use your phone camera. Just don't record. That'd be weird.
Yeah.
So prop up your camera.
Unless you really want to.
Unless you really want to, and that's like arousing for you. Great, you do you. So you've got your camera propped up, and you're just watching yourself open up your labias, and then explore. Okay, so here's my butthole. Here's that perineum that Sarah was talking about. Here's my vaginal opening. Where do I pee from? What does that hole look like? The first time I looked, I was like, that's what the urethra looks like. It's just this hole coming out of me. Like, what is this? It's crazy.
And for some women, it's in their vagina. And so that's confusing too.
That's right. It can be hiding in there. So every woman's, when you think about this, every woman's vaginal area, so their vulva, look different. It's just like a wildflower.
Yes.
Every wildflower is different. And when you look at it, you're like, it kind of does resemble a flower down there. This is pretty cool. So taking the time to just look and explore is really, really key too. So if you feel weird about just sticking a finger in there and exploring that way, throw some gloves on. Throw some sterile gloves on, wash your hands, do different things like that. Throw some lubrication on if you need to, and just breathe through it. So as you're breathing through it, what does that mean? So you don't want to be like making like basically hyperventilating yourself while you do this.
Right.
Try to have some just like calming, relaxing music going, candles, lightly dimmed room, just something to keep it easy for you. Or if you're a bath taker, try it in the bathtub.
Yeah.
The bath is great.
Absolutely.
It's a great, great place. Throw some bubbles in there if you like some bubbles in your bath. And just explore that way of like being able to stretch and move the canal around just so you can see what it's like. Or if you're comfortable with it, allow your partner to help you with this. So you know that it's just a finger. Let them help you stretch and be comfortable that way. So from a foreplay standpoint there, before you get into intercourse. And what I also tell ladies is not necessarily go out for coffee, but go grab some coffee, come home, and have a conversation about this without being in the bedroom. Talk about expectations, what that looks like for you. Have that trust built together, because the second that you don't have trust, you're going to go back into that fight or flight mode, and you're going to tense up, and it's going to hurt. It just will. So being able to be comfortable with someone and be open about things. You don't necessarily have to tell them about all of your past traumas and all that type of stuff.
Nope.
Just say, I've gone through some stuff and it's been hard, but I trust you and I want to do this with you. So being able to have those conversations are super, super important as well. And when it comes time for the big moment where we are inserting a penis or are inserting a sex toy of some sort, taking it yourself and putting it in versus letting him or her put it in as well. So being able to take that control for for a few trials. That way you feel comfortable. And it's basically, if you have dilators and are using them, it's the same concept, only it's attached to someone per se.
Right.
So that could be helpful for you as well. Another thing is, if depth of penetration is painful for you, using something such as O-Nut. It's OH N-U-T, literally how it's spelled. These are fantastic. So what I have pulled up is the Onut, and what they do is there's different layers to them. So you can imagine it being on a penis or on a sex toy, and they just go on. They are very, very stretchable. I forced my husband to try them for me. So we used them, not this one, but we used them. Yeah, I won't use that. So we used them, but what's nice is, yes, they're there. Yes, they are on, but they aren't constricting to him either. They're very flexible, they're very movable, and they're good. So that can help control the depth of penetration. And then as you get better with it, there's 4 rings that it comes with, and you can take a ring off to get deeper. So you can play with the depth and use this even with your pelvic health therapist. They can coach you through how to use them, how to put them on, all that type of stuff as well. And Onut has actually come out with...
I love those. I have a set at my office too.
Yes. Onut has come out with a vibrator on them as well. I haven't used it yet, but I'm
awesome.
That sounds kind of fun. Sounds kind of fun. So
we should email them, see if they'll send us one.
Yes, that would be wonderful. They're great.
Yeah.
But yes, so that's kind of where that, like I said, the pain with intercourse, we could talk about this for hours.
Yeah.
But like I said, we're breaking it down into these like 3 subgroups of that first time in aging, where we've got hormone changes, getting into that postpartum period, and then around that fear and trauma. So know that there's options out there for you and help. And I'm super, super excited that we were able to talk about this today.
Yeah. So tell me, Sara, if let's say somebody comes to me and they want to go to pelvic floor physical therapy, I refer men and women because men have pain with sex too. Sometimes 100%. Their pelvic floor is really tight and stuff. And maybe I'll have you back on and we could do that one too. But so somebody goes to a pelvic floor physical therapist office. What can they expect?
Okay, so each office can be different, kind of depending on where you go. So if you're going within the hospital-based setting, a lot of times they are going to use, not that I'm bashing them, they're going to use some outdated technology a little bit versus going to a specific practice or specific clinic that is pelvic health related. They're going to be more functional based, a lot of times more inclusive, more understanding, not getting you through the door, because pelvic health is not like traditional therapies. It's a lot different than just going through and having a shoulder surgery and let's move that shoulder around, let's stretch it out, that type of thing.
Yeah.
Pelvic health is slightly different. So you're going to be very welcomed, I would hope. If you're not, find a different one.
Yes.
You're going to feel heard. You're going to feel accepted. And you're going to understand that what's happened to me or what I'm going through is common, but not normal, and is going to be helped or be able to be fixed for you as well.
Yeah, that's awesome. So you'll have like kind of an initial consultation kind of session, and then you develop exercises, you do an assessment physically. What's the next step?
Correct. So depending on comfort level, you may have an external or internal exam. If you're not comfortable with that, there's so many things that we can do with your pants on. But I personally feel that the best route is to have that internal exam if comfortable, and depending on where you are, what's going on, have that internal exam to get the full picture. Now, that internal exam can be just obviously one finger insertion. It can be just up to the first knuckle and then you tap out. Like, that is totally fine. You have control of every single move that happens. Your therapist should be talking you through every single step that they are doing. Consent is very, very big in our world of pelvic health, and we want you to be comfortable with this because we do understand that things can trigger when we're doing these types of exams. The number of tears that we've had on my table is a lot, but it's in a good response. So yeah, exactly. So we go through exercises, we go through learning how to lengthen the tissue, learning how to strengthen it back up. You hear the word Kegel and people kind of cringe at it. They're like, I know what that is. I just squeeze my butt. Like, that's what
Yeah.
people think it is. And a lot of,
Right.
I would say 90% of the people that I get on my table do them wrong. So know
So
that
wrong.
as well, that you
Yes.
are probably not doing them correctly if you think that that's
And also
what
that's
you need to do.
not the end all be all for pelvic
No.
exercises. Sometimes
You're
it's harmful.
It is, exactly. So I always tell people, if you think about doing a bicep curl and you're holding that constant contraction of a bicep curl, and then you're asking that bicep curl to curl more, it has nowhere to go. You're basically hitting a brick wall. So if you're having leakage, your bladder is literally hitting a brick wall and has nowhere else to go but out. Or you're in that constant state of contraction and you're trying to accept a penis or a sex toy, it's not going to work because it's so tight that it can't relax. So
and I think that's one of my favorite things to tell patients that I'm sending there is that pelvic floor physical therapy, correct me if I'm wrong, but the way that I understand it is as much about strengthening and teaching those muscles how to work correctly as it is about lengthening and stretching and relaxing those muscles so that you aren't constantly in this state of tension and you can control your urine and accept something into your vagina and all of those things. I think it's so important for people to realize that we've been told these Kegels our entire lives and that this is like the holy grail, and it's not.
It is not. 100%. It is not. It is not the holy grail. You're exactly right. It is just as important to lengthen as it is to strengthen, and then getting into what I call the prosper phase. So I tell people, I take them through a pyramid process. We got to lengthen everything out to create that blank canvas. Then we have to re-educate it and strengthen it. And then we get into that prosper phase where you flourish physically and are able to do the things that you need to do again. So
it's just awesome. I love this. I love this so much. I really do. I incorporate pelvic floor into my daily office work as much as I can, and I send women and men all the time. So I just appreciate you being on here with us today and educating on this. And I think we've got a great topic here, and hopefully everybody will check you out. I'll put your information in the bio here today, and certainly be able to look for some things on the YouTube channel that you just showed us, and we can explore things. And thank you so much for coming on.
Absolutely. This has been so much fun. Thank you for having me, Steph.
You're welcome. All right, everybody. We'll see you next time on Between the Sheets. Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics Between the Sheets.